Hello and welcome everyone to our webinar.
In this webinar, we're going to be talking about workplace suicide prevention in the fire service. And we have two guests, and I will let them introduce themselves. Let me first turn it over to Assistant Chief Manny Almaguer.
Hello, everyone. This is Assistant Chief Manny Almaguer with Denver Fire Department. I have 23 years in the fire service and have worked extensively since around 2013 with workplace suicide prevention and rolling out a training program for the Denver Fire Department of over 1,000 members. Previously, I was a psychiatric RN in an institutional setting for about 5 years, with a total of 11 years in the mental health care setting. I love to travel, spend time with my family, and I will turn it over to Chief Greg Flynn.
Good to be with all of you. My name is Greg Flynn. I'm from southeastern Michigan, the community of West Bloomfield. It's about 36 square miles there. I have the privilege to be the fire chief of 99 staff, career firefighters there. Shortly into 2016, we lost a firefighter to death by suicide. And since then, I've learned much more and become an advocate for suicide prevention. Very much enjoy the self-care of being with my family, being outside, and definitely a great opportunity to be with you today and share some of the things that we're doing in Michigan.
Excellent. Well, thank you both so much for making time today. Again, this is all part of the National Guidelines for Workplace Suicide Prevention, which is supported by a collaborative partnership between the American Foundation for Suicide Prevention and United Suicide Survivors. This national guideline is built on 8 guiding principles, and you can go to the website workplacesuicideprevention.com to learn more about each of these, as well as 9 practices. And today, our 2 presenters are going to focus on the implementation of the guidelines, especially in areas of leadership, peer support, and mental health and crisis resources. Take it away.
One of the first goals is really to make sure that suicide prevention and training awareness is a priority within every engine house across this nation.
We need to reinforce the need to advance the cause for workplace suicide prevention, finding a balance between using data and resources available to firefighters, as well as to lived experience and storytelling to create a culture of change in behavioral health. In addition, make recommendations on easily accessible trainings and resources for short-term interventions so we can get ahead of firefighters and first responders before they experience a crisis, and integrate into some long-term programs and trainings that are sustainable for overall member wellness.
For the fire service, we've long had a stigma that has surrounded, and I think it's careful, and I think Chief would probably agree that we often reference a long-term standing. I would actually probably push back and say that the cultural barriers are coming down, and it's because of conversations like this that have been happening over and over again in engine houses, because of the awareness and the normalization of the conversation about emotional health and wellness issues within the fire service.
And 20 years ago, when Chief Flynn and I came on, mental health, behavioral health, suicide was a very taboo subject, where I believe within the last 10 years, we have been more comfortable in having these conversations and has been more accepted in the fire service. We have a lot of work to do, but we have our foot in the door to create great change.
And I think that change started for us here in Michigan with an initiative that took place shortly after Jeff Hiltner's death by suicide. And the discussions about the need for culture change were very apparent and were happening relatively frequently. We saw it regularly in periodicals and journals and within the fire service that talked about it. But what we were really looking for were actionable steps. And what happened, what the genesis for all of this came from some discussion shortly after Jeff's death, that we needed something more. We looked for training programs, which were out there and were vetted and were good, but some of them were just a little bit either too costly, or we needed a specialized instructor to come in. And we were looking for something that would be applicable from the Upper Peninsula part of the state of Michigan all the way down to the city of Detroit. And what came from that really was this idea of a campaign, the campaign of changing one attitude at a time. And by changing one attitude and another attitude and another attitude, we actually start to see this impact of culture change, which over the past year, since 2018, we really are seeing that change. And it's morphed into some things here, like you can see a picture of some of my team out in front of one of our engines with our September suicide prevention initiative, our t-shirt initiative, where we, with departments across Michigan, all wear the same t-shirt with the message of suicide prevention. No logos associated with a particular department, just a unified message of suicide prevention and overall emotional wellness.
So some of the implementation of the national guidelines in the workplace for Denver Fire Department remains peer support as being the most utilized resource for members on the department. And the peer support is a combination of members who are trained in peer support techniques, interventions, being progressive with the latest models in behavioral health. In addition to our peer support team, and how we supplement the peer support team is with the use of the department psychologist as well as chaplain services. Some members prefer to have that spiritual element in recovery from loss, or as well as while they're in a potential crisis, or as a midstream and upstream solution. One of the more innovative programs we've had within the past year has been the Department Recess program. And what Recess stands for is Resiliency Education and Coordinated Establishment of a Support System. And what that is that a member has the opportunity to voluntarily pull themselves out of their work environment, say the firehouse, and go to a 40-hour work environment in support service, which would be what we would call in the fire service, in the office. And at that time, they meet with the DFD wellness team, and they go over 8 criteria, building resiliency, as well as to come up with some strategies for positive coping. And that is emotional health, environmental health, financial health, intellectual health, occupational health, finding some meaning in your work, physical health, social health, and spiritual health. And it can be full or partial, meaning that if it's full, you put in about 80 to 120 hours and you come up with a plan and a program tailor-made for you. And at completion, and you meet with the department psychologist and you meet with the DFD wellness team, you can make that transition back into the firehouse and continue to have that follow-up. Now, if it's something that's a partial program involvement, then it's more self-guided and kind of tailor-made to your needs, but you can still remain in the firehouse. You can refer yourself. It can be referred by a supervisor, as well as it can be a referral from the chief or the administration division. So within the next year or two, I hope to have some data on the utilization of the program. And I feel that's good. It's a step in the right direction. And one of the things I want to talk a little bit about is it does identify the job strain. And mainly over the past 2 years, with what the fire service and first responders have been challenged with the pandemic, as well as to some of these social unrest issues, which have started to infiltrate into the fire service. It's really become impactful and has been challenging to firefighters. So this is an opportunity for this program, as well as peer support, to identify those job strains, and to always find that balance in making that transition back into the workplace to avoid the stigma, which is one of the objectives of Recess, is to reduce the stigma, to encourage some self-reflection, to just basically hit the reset button and get some rest, and to always to minimize self-assessment, minimal self-assessment tools and crisis inoculation planning. And this is the part where it's that balance between being self-guided, as well as to utilize the professionals and the experts that are available through resources in our own department network of behavioral health programs. And unfortunately, in the fire service, line of duty deaths has always been something that has been a reality of our profession. For example, on the Denver Fire Department, I put on a pin every morning I report to shift. It goes on my uniform. It's a reminder of never forgetting those who have lost their lives to a line of duty death. And in the department, I believe we have 57. However, since over the past 10 years, we know in the fire service that suicides have been more prevalent than line of duty deaths. And in the Denver Fire Department, we've had 3 suicides within the past year and a half. And this picture is the reality. Unfortunately, it has become too commonplace in the fire service and something that we never want to become comfortable with. And it becomes a little bit more complicated and complex, in that you can easily attribute members across the fire service and the first responder community that by taking their lives, there is definitely can be attributed to the trauma and experiences through being a firefighter, law enforcement, or paramedic. Well, we need to have those downstream approaches post-vention where we allow our members to heal, to grieve, to cope with loss, and to be able to make that transition and to avoid the stigma and return back to the firehouse. And over the past 20 years, and I know I can speak for Chief Flynn, that when we came on the fire department, I can tell you there was really only one resource that we had available to us, which is the Office of Employee Assistance. And that was, it wasn't common for that to be shared by all members throughout the city. And as we have become more resourceful and being able to kind of step outside our comfort zones and realizing that there are many outside networks, professionals, psychologists, therapists, you can tailor make your needs for you. As I mentioned, peer support as well as chaplain services. We have public safety therapists that either have been in law enforcement, have been in the fire service, have been paramedics. They speak the language, they know the trauma, and they know the experiences, and they kind of cut through that layer of getting to know each other and getting to know kind of where you have arrived at. They just know that they can delve into that trauma and experiences, and you can use it as a starting point, and you have more faster results. And from what I'm hearing from members of the fire service, when they feel heard when they meet with public safety therapists.
What we had to do, because there wasn't as many resources locally, we had to really work with our employee assistance program and go in and vet and meet with those that didn't have those personal experiences like you just highlighted that some of the resources have, and just bring them into the engine house and provide that opportunity when you don't have that luxury of so many healthcare, mental health professionals in your area. So that was a big thing that came out of Jeff's death, was a wellness visit to our employee assistance program, encouraging firefighters to go in and meet with a counselor before they're in crisis and create that relationship. And also, one of the things I'm sure you've heard also is that they don't know our job, or I didn't make a good connection when I was in crisis. And we lose that one opportunity for that mental health professional to make an impact. If we can get in and make that impact while they're well, create the relationship, then when they feel crisis coming, they're much more comfortable re-engaging with that mental health professional.
Thank you both so much for your time today and sharing your experiences and lessons learned. I hope you all will tune in to the National Guidelines for Workplace Suicide Prevention by visiting workplacesuicideprevention.com and take the pledge. Once you become a registered pledge partner, you'll have access to many of the tools and resources discussed here, and we hope you make a difference in your community.